I had my third dose. I'm really happy right now. I call on all our citizens as a responsible citizen. We should get the third vaccination for the health of our people and our state.
I'm so happy because I was vaccinated twice. I felt no sickness, no distress, and no pain. I feel like the third one will be the same.
It was done very quickly and very nicely. There hasn't been a single problem.
Derya Unutmaz is an immunologist at the Jackson Laboratory, and he joins us now from Istanbul. Derya, thank you so much for your time. Why has the decision been taken to give a booster now? Because as far as I know, we don't really understand how long immunity lasts from 1 or 2 doses yet.
So I believe the third dose is specifically for those who have gotten the Chinese vaccine, the Sinovac vaccine, which is an inactive vaccine. And given that we have the Delta variant, which is more infectious and is able to escape from some of the antibodies, I think this is a very right decision to do the third dose. Those who had Sinovac before and the third dose BioNTech would definitely increase the protection. Actually, several other countries have begun doing this as well. Bahrain and United Arab Emirates, they have been given a third dose of BioNTech, those who had the inactive vaccine. Those who had 2 BioNTech vaccines, I don't think they need the third dose right now, because those vaccines generate a very robust immune response, which we think is going to last for a while.
And apparently people are being told that come for your booster and actually make your choice about what sort of vaccine you want, regardless of what you were given the first and the second time. What's your understanding in terms of the trials that have been done regarding mixing vaccines? I mean, we know that some other countries have been conducting these trials. What does Turkey know about its own research, or is it speaking to other nations?
I think it would be better to be more clear on this. It's definitely would be much more beneficial to have the third dose done. BioNTech, if you had a Sinovac before, because clearly mixing vaccines is more effective. For example, in England, those who had AstraZeneca are given BioNTech the second dose, and you get a very robust, very good immune response. So immunologically, that makes a lot of sense. Also, BioNTech vaccine is a much more powerful vaccine. So I would recommend people who had the Sinovac vaccine just to go and get the BioNTech, because that's a great opportunity. They can, of course, have this Sinovac as a third dose, but it's not going to be as effective. And given the Delta variant, which is able to escape some immunity, it would be better to have some clarity there.
Derya, what do you think is going to be the situation moving forward? I mean, I've spoke to one particular expert, and I think others kind of agree as well, but this particular expert said to me that your grandchildren are going to be living with SARS-CoV-2, but obviously we're going to be able to vaccinate people. But in terms of what we might require regularly over the coming years, are you thinking 1 injection every year, or are we possibly looking at 3 separate injections every year?
I don't think we're going to need a new dose every year. What might happen is that we might get a third booster dose that might be a slightly different vaccine developed specifically for these variants, such as the beta, gamma, and delta, which are able to escape the antibodies. But I don't believe that it's going to be like influenza, for example. Every year we get a different vaccine, because the virus doesn't really change itself that much. But I do agree that the virus is going to be around for a long time. The important point is that if we prevent severe disease and death, which is absolutely happening all over the world, it will be kind of like influenza. We're going to learn to live with it. We'll tolerate it. It won't be as scary as it is right now. So I'm much more optimistic for future. And I believe towards the end of this year, the pandemic will be over, and we'll return to our normal lives.
Derya, my producer is saying we have to move on, but I really just need a very quick answer on this. What percentage of a population needs to receive both doses before the nation as a whole can consider itself safe?
If it's the BioNTech, Moderna vaccines, I would say between 60–70%. If it's not, other vaccines, we might need 70–80% of the population vaccinated.
Really appreciate your time, Derya. Thank you so much indeed. Derya Unutmaz.